The presentation of the unit 1.3 acquired disabilities, brain injury, and spinal cord injury includes the following content items. Part 1, brain injury, causes and sequels, spinal cord injury, causes and sequels, and additional learning materials. Brain injury, causes and sequels. Here we see the image of the human brain anatomy that depicts the parts of the human brain with the frontal lobe, parietal lobe, occipital lobe, cerebellum, spinal cord, and temporal lobe. What is an acquired brain injury, or ABI? The brain damage acquired during the lifespan and is not related to the congenital or a degenerative disease. ABI may cause temporary or permanent disability affecting several domains of human functioning, including social participation. Causes: trauma or injury to the head, traumatic brain injury; stroke, ischemic or hemorrhagic; prolonged lack of oxygen to the brain due to cardiorespiratory arrest. Other causes, for example, infections, tumors, toxic metabolic encephalopathy. Sequels. The outcome of acquired brain injury can range from a disorder of consciousness to full recovery. Long-term consequences may include, in various combination, impairments, as well as a various degree of activity limitations and participation restrictions. Disability following ABI may result change in family roles and relationships, loss of employment, lack of social opportunities, up to isolation and social withdrawal. The long-term effects of brain injury are different for each person, but can be addressed with a proper management and support. Effects will vary based on the type of condition, the nature of location of the injury, and a variety of other contributing factors. For example, while degenerative disorders typically impact the body's ability to control movement, other brain injuries may have an impact on cognition, personality, and behavior. Understanding how different effects specifically impact a person allows for appropriate management strategies and support to be put in place. Sequels continued. Sequela at the alert level. Consequences in motor control, sensory and sensory alterations, consequences in communication, sequela in cognition, sequela on emotions, behavior, and personality, consequences on activities of daily living. Spinal cord injury, causes and sequelae. Here we have the image of the spine and the parts cervical, thoracic, lumbar, sacral, and coccygeal. What is a spinal cord injury? The term spinal cord injury refers to damage to the spinal cord resulting from trauma, for example, a car crash, or non-traumatic causes, for example, degenerative diseases, cancer, and others. On the right-hand side, we see the images of complete spinal cord injury and incomplete spinal cord injury. For the case of complete spinal cord injury, we see the paraplegia and tetraplegia or quadriplegia. For incomplete spinal cord injury, we have the cases of paraplegia and tetraplegia or quadriplegia. Symptoms of spinal cord injury depend on the severity of injury and its location on the spinal cord. Symptoms may include partial or complete loss of sensory function or motor control of arms, legs, and/or body. The most severe spinal cord injury affects the systems that regulate bowel or bladder control, breathing, heart rate, and blood pressure. Most people with spinal cord injury experience chronic pain. Demographic trends. Males are most at risk in young adulthood, 20 to 29 years, and older age, over 70. Females are most at risk in adolescence, 15 to 19 years, and older age, over 60. Studies report male to female ratios of at least 2 to 1 among adults, sometimes much higher. Causes. Traumatic spinal cord injuries occur due to motor vehicle accidents, slips or falls, also acts of violence, sports-related injuries, medical or surgical, and other cases. Another way to characterize spinal cord injury causes is whether the damage is complete or incomplete. A complete spinal cord injury is where the patient loses all functions below the point of injury. Complete spinal cord injuries cause paralysis. An incomplete spinal cord injury is where the patient has some feeling and sensation below the point of injury and does not always cause paralysis. Incomplete spinal cord injuries are more common than complete spinal injuries. Non-traumatic spinal cord injuries occur due to degeneration of the spinal column, infections, cancer or tumors, inflammation, and congenital medical issues. Sequelae associated with health conditions. Spinal cord injury is associated with a risk of developing secondary conditions that can be debilitating or even life-threatening. For example, deep vein thrombosis, urinary tract infections, muscle spasms, osteoporosis, pressure ulcers, chronic pain, and respiratory complications. Acute care, rehabilitation, services, and ongoing health maintenance are essential for prevention and management of these conditions. Sequels, economic ones. Spinal cord injury may render a person dependent on caregivers. Assistive technology is often required to facilitate mobility, communication, self-care, and domestic activities. An estimated 20 to 30% of people with spinal cord injury show clinically significant signs of depression, which in turn has a negative impact on improvements in functioning the overall health. Sequels in the social area. Misconceptions, negative attitudes, and physical barriers to basic mobility results in the exclusion of many people from full participation in society. Children with spinal cord injury are less likely than their peers to start school and, once enrolled, less likely to advance. Adults with spinal cord injury face similar barriers to economic participation, with a global unemployment rate of more than 60%. Existing data does not allow for global cost estimates of spinal cord injury, but it offers a general picture. The level of severity of the injury has an important influence on costs. Injuries higher up on the spinal cord, for example, tetraplegia versus paraplegia, incur higher costs. Direct costs are highest in the first year after spinal cord injury onset and then decrease significantly over time. Indirect costs, in particular lost earnings, often exceed direct costs. Much of the cost is borne by people with spinal cord injury. Costs of spinal cord injury are higher than those of comparable conditions such as dementia, multiple sclerosis, and cerebral palsy. And here we have the list of additional learning materials and other information provided to expand the knowledge on the topic. And this concludes the presentation of the unit 1.3.